Hi, I'm Dr. Anndrea Hatcher from Olive Branch Parke Veterinary Clinic. Today I'm going to talk about heartworm disease. In veterinary school, I had a pathology professor who told us never to describe disease in food terms, but I can't help it. Heartworm disease doesn't look like anything other than a heart full of spaghetti. So I hope you aren't planning to have pasta tonight. Heartworm disease most commonly affects dogs. Cats may also get the disease, but the disease process is much different in them. Rarely immunocompromised humans will also get heartworm disease. Heartworm disease is spread by infected mosquitoes. When the infected mosquito bites a dog, it injects tiny heartworms into the dog's blood. It is the goal of all baby heartworms to move into the penthouse of blood vessels in the lungs, and maybe even the right side of the heart when they grow up. A dog with early heartworm disease may only have a few heartworms, and it won't appear sick. Later, the dog will have a chronic cough. It won't want to play or eat much and may lose weight. In advanced heartworm disease, you can imagine a heart that can't pump blood very efficiently when it is full of spaghetti-like worms. Fluid ends up backing up, and the dog may develop a pot belly full of fluid. Eventually, the dog will die from heart and liver failure. Veterinarians look for heartworms with a blood test. Most dogs with heartworm disease can be treated and cured of the disease. However, the treatment is expensive, time-consuming, and not without risk. There is a chance that the medication used to kill the heartworms will kill too many heartworms too quickly. The dead worms may then float down the bloodstream like sticks into a beaver dam. The blocked bloodstream is called an embolism. Things downstream of the embolism don't get any oxygen. This is pretty bad if the organ downstream happens to be the heart or the brain. It is always easier to prevent a disease than to treat it. There are many brands of heartworm preventative currently available. In Indiana, I recommend giving your dog or outside cat heartworm preventative once a month all year round. Our weather is too unpredictable to assume that all mosquitoes will be killed during the same months of every year. Some also recommend year-round heartworm preventative for indoor cats. Why does your veterinarian make you bring your dog in for a heartworm test before refilling the heartworm preventative each year? 3 reasons. Number 1, sometimes even I forget to give my dogs their heartworm preventative, and I do this for a living. Number 2, I can't think of a medication that is 100% effective on 100% of the patients. And number 3, if a dog with heartworm disease is given heartworm preventative, and all the microfilaria, which are the baby heartworms in the bloodstream dreaming of the good life in the lungs and the heart, if they're all killed at once, there is a slight risk of the dog's body producing a fatal reaction to the dead worms. So, next time you sit down to a big dish of spaghetti and tomato sauce with meatballs, be sure to ask yourself, did I give Fido his heartworm preventative this month? And by the way, have I talked to you about neutering?